Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Heart Valve Disorders in Adults, Types and Treatments, presented by Dr. Harsh Agrawal, cardiologist with Washington Township Medical Foundation. Dr. Agrawal is board certified in interventional cardiology, cardiovascular disease, and internal medicine. Prior to joining Washington Hospital Healthcare System, Dr. Agrawal practiced at UCSF Medical Center in San Francisco. He now contributes his expertise to the Washington Township Medical Foundation's cardiology care team as one of its providers. Dr. Agrawal's care philosophy prioritizes his patient above all else, driven by his personal connection to the treatment they receive. His father's battle with heart disease has deeply influenced his perspective, cementing patient care as a top priority. With this commitment, he strives to improve the healthcare climate and enhance people's experiences. In his free time, Dr. Agrawal enjoys hiking, soccer, reading medical journals, and teaching. Please welcome Dr. Agrawal.
Hi, my name is Harsh Agrawal. I'm one of the heart valves and a cardiologist at Washington Township Medical Foundation and Washington Hospital. Thank you for joining me. I wanted to talk about structural heart diseases and heart valve disorders that can affect our community as well as the population worldwide. Just wanted to start with the procedures and types of diseases that we encounter in the day-to-day basis in our population, especially something called aortic stenosis and mitral stenosis or regurgitation, tricuspid stenosis or regurgitation, pulmonic stenosis or regurgitation, atrial fibrillation, left atrial appendage occlusion, and other disorders. You might hear these medical terms used by your doctor, your cardiologist, or your primary care doctors, and most of these are heart valve disorders that you encounter whenever you see a medical provider. What is aortic stenosis and why are we worried about it? Aortic stenosis is one of the most common heart valve disorders in the world, and it has come to focus more and more as our science is advancing. It's basically a narrowing of one of the main heart valves of the heart that connects the heart to the largest blood vessel, the aorta. It occurs over time. It can happen due to diet, smoking, definitely due to our dietary modifications can help it, calcium buildup, as well as some genetic predisposition. There are some people who are born with it, but that's very, very rare and a congenital heart form disorder. Basically what it means, it's narrowing of the heart valve. It prevents the blood from flowing outside the heart to your body and makes the heart work very, very hard to the point that it can fail. Why is it serious? Why should we worry about it? As I said, it's in the US alone, 2.5 million people are affected who are above 75 years of age. And given our prolonged life, now people are living to 95 to 100 years old. This is very, very common and seen very commonly in our clinics and in the community. It is a progressive disease. It will progress over time, and that's our main worry and concern, to prevent its progression or to treat it as much as we can. It does require a medical diagnosis. You have to see either a primary care doctor and they refer to a cardiologist or a structural heart valve person to help with your diagnosis. Why do we worry about it so much? Because it can cause the heart to weaken, cause chest pains, cause fatigue, cause shortness of breath while you walk. Let's say you used to walk up a flight of stairs, you can't anymore. There might be something going on with your heart that you need to get checked out from your primary care provider or your cardiologist. As you can see, it's very common, more common than you can see, more than 200,000 cases in the US alone. It's very treatable, and also we have to do a few lab tests and imaging tests to make sure you are the right candidate for any procedure if needed to treat this disorder. it is a chronic disease. If we don't treat it, it will last and progress, as I said. But treatment can be very, very satisfactory. It can help alleviate your symptoms right away, and you can go back to a normal life. What causes it? As I mentioned earlier, most commonly, the common things are common: high blood pressure, high cholesterol, diabetes, if you have kidney problems, and I said some individuals are genetically predisposed to it. Also, your diet and lifestyle definitely affects it, and smoking, which is a big risk factor for progression of this disease. Symptoms, there are many symptoms, and some of them can overlap with other diseases. Anyhow, but if you see any of these symptoms, you should contact your medical provider or your cardiologist to at least get it checked out and make sure you don't have any heart valve problems like chest pain while walking or even at rest, and that's new. Difficulty walking, dizziness, if you're losing your balance, if you're getting very, very tired and sleepy, if your feet are getting swollen, if you have something called leg edema. Again, if you pass out for unexpected reasons, or if you're very, very close to passing out that you had to sit down. Also, difficulty sleeping, fainting, as I said, that's a very serious symptom. If your heart feels that it's beating really fast out of no good reason, like if you're working out but you're just sitting in bed, that's something called rapid heartbeat or palpitations. And again, shortness of breath is a very, very common symptom of multiple diseases, but including any heart disease, and that should be taken very seriously. Treatment. Thanks to medical science, for the last 20 years, we have advanced in treatment for all of these disorders, and most of them we can do here at our Washington Medical Foundation, either in Fremont, or some of us can even go to the city and provide these treatments for all of our patients. Mild cases, generally when you get diagnosed, we observe you, medications, and every year ultrasounds, but no invasive treatment is required. More severe cases, generally require surgery to repair or replace the valve. About 20 years ago, open heart surgery was the only option for mostly all of the heart valve diseases. That is not true anymore. A less invasive approach called TAVR or transcatheter aortic valve replacement is now available here in Fremont and all over the Bay Area for patients who have this disorder. What is a TAVR? And you might hear this term thrown out loosely. It basically means to replacing the aortic valve via a catheter route instead of an open heart surgery. So TAVR is a minimally invasive catheter-based procedure that eliminates the need for open heart surgery. Instead, we can go through a small incision in the leg artery, and using imaging, x-rays, fluoroscopies, and ultrasound, we can actually deploy a heart valve which is customized to your heart and your size in the heart. Once the valve is positioned correctly over the diseased valve, it begins to work at once. So you can see here, if we go from here with a catheter, and the valve itself is right here, and as soon as it's deployed, it starts to function right away. And this is done on a beating heart, in a conscious sedation. You don't have to be completely put out for it. I want to take us through this video, which is made by one of the heart valve vendors, to show you how exactly we can replace your heart valve without an open heart surgery. So as you can see, this is the femoral artery near your leg, and a catheter goes all the way into the valve, and right here you can see this is the aortic valve, this is your heart, and that's the catheter coming all the way near the femoral artery. Now we take one more catheter, and the valve comes crimped on a balloon sometimes. This is a balloon that goes in the valve in the heart, and we expand it to open the valve up. So now this gives you more blood flow going towards the heart and also to the body. And now you shall see slowly we will come up. This is the valve itself. It's basically crimped on a balloon, and it's a self-expanding valve made of nitinol and tissue pericardium. Once the valve goes in, you can take it all the way inside the heart itself, and through a really controlled deployment, we can slowly release the valve and it expands and sits behind your diseased valve. Right away, the valve will start functioning, as now you can see this is a fully functioning new aortic valve, just like an open heart surgery, but without the need for an open heart surgery. And here you can see the pericardium and the valve, how it looks, and it sits where your old valve was. But this is a completely open, fully functioning valve with the maximum amount of blood that's needed that can go through now to your heart, to your body. So yeah, that was the video that showed how the procedure itself is done. It's done through a minimally invasive option with about a 2 centimeter incision in the groin area, and the recovery time is about 4 hours. You'll be awake. After that, you can eat, you can walk in 6 hours, and you will go home the next day with recovery within the week. There is no general, so I just wanted to compare if you undergo an open heart surgery versus this minimally invasive option. You don't need general anesthesia. You do not need a heart-lung bypass machine. This is done on a beating heart, and no bypass is required, and it's very small incision. Open heart surgery takes around 6 to 8 hours. This procedure generally takes an hour, and the hospital stay, as I said, is 2 days at best. Open heart recovery is generally 8 days in the hospital, and then about 6 to 8 weeks of recovery from your open chest. The healing, again, for something like this, a recovery is 1 week. Again, this has to be done by a medical professional, but we can select the right patients for the right procedure. There are some patients who will need surgery and an open heart surgery, but that decision will be made with the patient, you, your medical provider, and the cardiologist and the surgeon. We do offer other procedures, and also we partner with tertiary care hospitals to provide all the procedures that patients might need that present to Washington Hospital or the Washington Township Medical Foundation, including transcatheter mitral valve replacement, left atrial appendage closure, so patients who are on blood thinners and cannot tolerate blood thinners due to something called a heart rhythm disorder called atrial fibrillation. People who are born with holes in their heart, we can close them with small devices now. And also we can do transcatheter valve replacements for other valves, not just the aortic valve, but there are 3 other valves in the heart that can be fixed using the same technique. And we at Washington Hospital and Washington Medical Foundation have partnered with other institutes that we can provide this service, the same team of doctors. We have our physicians, Dr. Ramin Begi and Dr. Tangli are CT surgeons that work with me. And we are a team that evaluate the whole patient together. Once you come and see us, you stay with us throughout the course of the procedure as well as post-operative course. Also, we follow you up for at least 2 to 3 to 5 years in our clinic with regular checkups, ultrasounds to make sure you get the best care you need no matter where you are. We have a whole team. We have our nurse practitioner, Kelly, who's amazing. Everybody has a cell phone number. We can call her at any time for any questions. We have a full comprehensive heart valve clinic where we all come together to make a decision what's best served for the right patient. Some patients might benefit from transcatheter therapies like I just showed. Some patients might need open heart surgery, and some patients might just benefit from medical management or medications. And that's something we do as a unit and as a team with all the physicians, the patient in the center, as well as our surgeons. So that's something we are really proud of, and this is something that I want to bring to the community here since I start. So thank you, and happy to take any questions.
Thank you very much. We do have a few questions. The first question we have, you mentioned about a 1-week recovery. What happens during that recovery if you only have a small incision?
The small incision generally heals in the next day or so. It's still, you'll see a small scar on the skin. So just to make sure the scar heals, we just ask you to take it easy. You can do your day-to-day activities. You can go for walks. We just ask you not to do any heavy lifting or weight lifting or go up too many flights of stairs. Other than that, you can shower, you can walk your dog, you can do all your normal activities that you want to without any issues.
Okay, great. And who would be a candidate for a procedure such as this?
Anyone could be a candidate. I have done patients from 30-year-old to about 102-year-old. It depends on, as I said, we'll do a full comprehensive evaluation. Generally, in the US, anywhere between 65 to 90-year-old patients who have these valve disorders are the best candidates. If you're functional, if you see your quality of life deteriorating, and if you're diagnosed with something like this, we can help you get back to your normal life.
Thank you. Our last question is, how is a valve replacement different from a stent?
So a stent is a much smaller procedure, but the idea and the technique are pretty much similar. Valve replacement is a bigger incision and a little bit more involved procedure, but the stent procedure, as you mentioned, is similar, and actually the valve replacement the whole model is based on how the stents were placed. So actually, if you can just say it's a different iteration of a stent placement.
Okay. Thank you. This does conclude our program. Thank you, Dr. Agrawal, for this insightful presentation, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.